Hello, my name is Dr. Ridhima Banerjee. I am a physician with a special interest in gut health diseases. Today, we will discuss a topic that is sometimes not addressed during medical appointments, and that is the relationship between social isolation and irritable bowel syndrome. Social isolation and loneliness can affect the gut brain axis, a concept that I have tried to explain in my previous videos. And you might ask, how does this occur? Now, it is important to understand that the body perceives loneliness and anxiety as a form of stress, and over time, this leads to a release of cortisol. This whole process can affect the gut in several ways. Number one, it can cause and alter the motility of the GI tract. This means that bowel movements can either increase or decrease, and this is the reason for the symptoms that are seen in irritable bowel syndrome. The second effect is that of an alteration in the microbiome of the gut. This can reflect in several ways. You might ask, what is a microbiome? Very simply put, it is a collection of millions and millions of organisms that live inside our gastrointestinal system, and they constitute different types of bacteria and other types of organisms, which are essential for healthy functioning of the gut. And when there is a high amount of cortisol, and when the gut brain axis is altered, it can affect this microbiome, sometimes causing a decrease in the diversity of it, and this affects the overall health of the gut. Another way in which the gut is affected is that it causes an increase in the sensitivity of the gastrointestinal system, causing what is known as a sensitive gut. And this is the reason why some IBS patients struggle with eating certain types of food or react strongly to other types of food which other people may not have the same reaction to. And lastly, the effect that is often seen in the GI tract because of an alteration of the gut brain axis is a disturbance and activation of the immune system. And what occurs is a process that medical professionals called neuroinflammation. Many times people ask me, what is inflammation? Very simply put, inflammation is the body's internal alarm system. And when the alarm bells inside the body start to ring, it has an army which is prepared to deal with this alarm system. However, if the alarm bells continue to ring for a prolonged period of time, it leads to problems. And this is what we see. In other words, we call it as the body's repair and response system. So that is what inflammation is. And you can imagine that when it occurs for a long period of time, it can affect the gut's ability to heal itself. Moving on, we need to explore the emotional connection between the manifestation of symptoms of IBS and loneliness. Many times I have thought about the psychological experience of people suffering from irritable bowel syndrome. And I have found that in patients who are not connected to a community or do not have a strong social support, that it worsens the psychological experience of irritable bowel syndrome. And you might ask that how does this occur? It occurs in several ways. For instance, such type of patients are often prone to rumination and what is called as catastrophic thinking. In other words, when there is no one around that person to help them understand their problems or to share in their burdens, it causes an increase in the perception of pain that they are experiencing. And what this ultimately results in is a vicious two-way loop. So, what happens is that patients who are socially isolated have an increase in their perception of IBS symptoms, and in turn, this leads to a worsening of the IBS symptoms, and this unfortunately ultimately results in even more social isolation because now that person is afraid and worried about going out into society and interacting and mixing with others because of the anxiety which they have over their symptoms. And as we know, the symptoms of IBS are such that it can't really be hidden. And these symptoms make themselves known publicly fairly soon. So, what we have is now a series of symptoms, for example, in which it results in gut distress, social isolation, and ultimately emotional exhaustion of the person who has now been struggling to deal with this problem for a long time. Now, finally, we come to the most important part of today's video, and that is how do we break this isolation gut cycle? And as we have seen over the last few minutes, that it is extremely important that we at least attempt to do so because small steps can have big results if they are sustained over a long period of time. So, the first action step that I would suggest is to try to reconnect socially. See if you can find a community of like minded people that you can interact with on a daily basis. Such groups could include places at your workplace or in your place of worship, or perhaps a group, for example, a hobby group that you attend, such as the Toastmasters, which but the main point is to see that they meet at a regular interval on a regular basis and preferably in person. It is even better if you have a shared interest so that you are able to develop your self confidence as well. Please don't be deceived by the simplicity of these steps. I have seen that they have a huge impact on a patient's health and well being, often making the difference between a person taking months to recover and another person taking years to recover. Another way in which you can connect socially is to volunteer. Try to find out and see if there are any groups in your city or where you live. And we have found that those who volunteer often have more peace of mind, and sometimes it results in a better control of IBS symptoms. Again, please try to ensure that volunteering is in person because that in person interaction is what is the vital element in this whole process. The other way, and very effective way, to develop a good community is to see if you can share meals with someone. For example, at your place of work, if you can share your lunch with a colleague or a friend, it makes a difference. I appreciate that, especially for IBS sufferers, that is sometimes difficult. And if sharing a meal is not possible, see if you can share a small snack and have some meaningful interaction with a colleague or friend during the day or later in the evening. There are other ways in which we can deal with the effect of social isolation and its distressing effect on the gut. And this technique involves various calming techniques. You might have read about them in other websites or perhaps in the newspaper. First among these are deep breathing. There are many good deep breathing exercises that you can do that go a long way towards calming down the nervous system and helping you to regain control of irritable bowel syndrome. Another way is prayer. And the last way in which uh, many organizations and many patient advocacy groups advise is called mindfulness. Now, moving on, the third step that I would recommend is to have a fixed routine. Now, I have found that often for IBS sufferers, they do not have a fixed bedtime or they do not have fixed meal times, often because of the difficulty in managing their symptoms. Do try as far as possible, especially when it comes to sleep, to have a fixed time when you go to bed and a fixed time when you wake up. This goes a long way towards reducing the stress that is placed on the gut, and it has a positive impact in controlling the symptoms of irritable bowel syndrome. Another way in which you can deal with loneliness, isolation, and sometimes depression, because that is not uncommon in this group of patients, is to undergo therapy. There are different types of therapy. For example, one that is useful is called CBT or cognitive behavioral therapy, and even group therapy has been found to be helpful. So, in your journey to recovery, try to consider taking these action steps, and these are vital alongside your diet and medication in helping you to manage and to live a good and a productive life. And lastly, the point that strikes me as particularly unique in today's digital age, and that is to limit what I call doom scrolling. So, I have noticed that often patients go through their social media accounts and keep scrolling downwards for a long time. So, what that happens is that it can cause quite an amount of stress because there is a lot of negative information also in the media, especially social media. So, do try to limit your social media intake and try to focus on content that is positive and that is helpful for you. Did you find this video helpful? Do you know someone who is struggling with irritable bowel syndrome and for whom diet is difficult to change or to follow? If you did, then please share this video with them. And if you were helped by this video in any way, then would you consider please liking and subscribing to this channel, because it helps me very much in the creation of such videos which take a considerable amount of time and research. I look forward to reading your comments and to hearing about your recovery from IBS. Thank you and take care.